I'm Dr. Manisha. I'm working in the Medical Affairs Division of UPIN. Today, joining with me is Dr. Neha, who is very well-renowned psychiatrist and mental health expert with us today discuss this meeting about the mental health awareness in patients suffering from polycystic ovarian syndrome or disorder. So, welcome, ma'am, to this session.
Thank you, ma'am. Thank you so much. A very good evening.
Very good evening, ma'am. So, as we are aware that this PCOS condition has become very common and more common among the women, particularly in adults and young and middle-aged women. And it is you, if you can see around us, there are one of the other patients affected with PCOS. But because of its pathology and various clinical symptoms and their impact on patient's life, it may sometimes link to some mental health disorders associated with some mental health illness or symptoms, signs and symptoms. So, can you more elaborate on this fact from your clinical perspective, ma'am?
Right. Uh, Look, PCOS presents with a plethora of symptoms. There are some symptoms like there are facial changes, weight gain, hormonal disturbance. So mental health issues are obviously much more common in women suffering from PCOS as compared to the women who are not suffering from PCOS. This can be either because of individual symptoms of PCOS, because if a person's appearance changes, the person has weight gain, or has facial hair, or has period issues. So the female is repeatedly feeling that whether I'll be able to conceive or not. There is an infertility issue going on. So because of those symptoms, also there are mental health issues. Secondly, as we know, PCOS is an illness of hormonal imbalance. So, because of these hormonal imbalance, also there are certain symptoms. Actually, as per recent researchers, what we have got to know that there are estrogen and progesterone, the female hormones. These receptors are present in our brain also, and when the level of these hormones disturb in our brain, they are responsible for causing various health conditions. As you have quoted, mental health issues, not only depression, anxiety, but also other health issues, maybe eating disorder like bulimia or anorexia, or OCD, or body image issues, hypochondriasis, etc. These illnesses are also commonly seen in women suffering from PCOS as compared to women who are not suffering from
Yes.
it.
So, can you, yes. So, as I understand from this conversation that it is very common, and these are the symptoms which are likely to be present in those patients who are having PCOS and some inclined towards a mental health illness. Can you also elaborate on something to make our viewers aware about the fact that is there any specific symptoms which are actually considered as alarming signal towards a mental health, condition getting deteriorated, and they should immediately consult their mental health experts?
Perfectly fine. Look, the patients with PCOS, they have primary contact with the gynecologist. So, as per me, every gynecologist should be trained enough to screen for mental health issues, common mental health issues like depression and anxiety. So, they should have that hands on training so that they can identify, and once identified, they can refer that patient to a psychiatrist for proper evaluation and treatment. If we talk about alarming signs, the alarming signs could be the patient's, the basic routine has altogether changed. A person who was all happy doing her work or office work or housework perfectly fine, happily. Now the behavior has changed. The person has started being very silent, withdrawn, not interacting much with each other, with family members, doesn't seem happy, or the person seems more irritable. There are anger outbursts, there are fights with family members. So rather than labeling the person as that this person is really rebellious, so the female should be considered that this is not the natural behavior of the female. This has started recently, not interacting, socially withdrawn, or talking of that the life is not worthful, or it is better to die off. Or they can be symptom that they are not taking care of their self hygiene, not taking bath regularly, not able to maintain their hygiene, or having repeated severe anxiety attacks, which are called as panic attacks. So these are red flag signs that the person should be referred to a psychiatrist. Even before these red flag signs, The gynecologist should screen a female coming with PCOS for all this.
Yes. Uh, Also, can you tell us more about how such patients are generally managed and how it is easy to manage such patients? It should not be stigmatized in our society. Can you elaborate or can you give us more details about this?
Right. For mental health issues, there's a common saying that earlier they are diagnosed, earlier they are treated, better will be the response, and lesser will be the sequelae. So the
Yes.
chances are that patient would recover earlier, faster, with less sequelae or less aftermath. As
Yes.
we know, there's a stigma associated with mental health. Then there's stigma associated with PCOS also. That people feel these are infertile females, unable to produce kids, etc., etc. But since, as we consider, the technology has advanced and there are multiple treatment options with which the cycles can be regularized and symptoms can be managed. Regarding mental health conditions, they are pretty common conditions. We also know the prevalence of mental health issues have is increasing day by day. And post COVID, we say COVID was one epidemic. Now mental health issues is in another epidemic that, as India, we need to deal with. So the treatment falls into two of the major category. Either we require drugs, that is pharmacotherapy, or non-pharmacological. There comes the counseling session or the therapy session. If these symptoms are in the range of mild or moderate symptoms, then they can be alone managed with therapy. We don't need to start the person on the medicine. But if these symptoms are really alarming in severe category, so we advise both the counseling and the medicinal treatment. And the best thing would be if the person has social support, if the family members are able to understand what the female is going through.
Mm. Yes. Yes. Thank you, ma'am. Thank you for sharing this important information with us. I'm sure that this information is definitely going to benefit our viewers who are watching currently this session. I would also, we have actually reached at this end of session. Before ending this session, I would like to, can you recommend something or can you give some concluding remarks to our viewers?
Okay. Look, mental health issues, they are not to be stigmatized. We all have, as per WHO reports, if we talk about, every person will suffer anxiety issues once in their lifetime. So why to stigmatize them? Let's talk about them. Let's be open so that they can be identified easily and can be taken care of at the early period of time so that they don't become severe enough. As we know, females are the foundation of the house. So they manage the household, they manage their own work, they manage the kids. If they are not healthy, how can we expect the house to be healthy? So they need to be taken care of before anything. The female should be healthy. If we want a healthy family, we need a healthy female.
Great. So, at the end of the session, I would like to give my heartfelt thank you for you sharing this information with us and also sparing your from your busy practice and also sharing important insights with us about these questions and very burning issue. Like if you see PCOS and mental health illness is most common but most neglected also. So this is very important what you have shared and definitely going to help our viewers also. So thank you so much. So here we'll say end of our session.
Thank you so much, ma'am. Thank
Thank
you
you, ma'am.
for
Thank
giving me the opportunity to talk about.